I think my job was gotten simpler because Dr. Seco presented most of it. So I'll probably would try to make it more interactive because I think we have redundant slides. So I'll get the first slide. So what I mean about clustering of risk factors is if you look at Filipinos and if you look at people in general, there seems to be clustering of risk factors. So if a patient is diabetic or if a patient is hypertensive, there's an increased probability that they also have diabetes. So in Filipinos, that clustering is a lot higher. And this is almost comparatively, it's also in comparison with like South Asians and Latinos and American African population. And this is not a phenomenon just in the US because we see it also in the Philippines, and I'll juxtapose those two data. So this was already, this is for the US. As you see, Filipinos on the far left with hypertension, and you go to the next slide, heart disease, you'll see Filipinos, at least they're at risk, not as high as the others like West Asians, but if you look at diabetes, Filipinos again are higher up there, only second to South Asian. And then at least one of the cardiometabolic conditions, meaning obesity, high LDL, low HDL, high triglycerides. And we had seen this also in the Philippines, and I'll show the data from the Philippines. Next slide, please. So this is the data from the Philippines. Dante Morales is the counterpart of the NHANES study here in the United States. So they do this in the Philippines every 10 years. This is data from 2008. So if you look at combined hypertension and pre-hypertension, we have about 37% are hypertensive in the Philippines, and that is going up to almost close to 50% in the Philippines. If you look at diabetes and impaired fasting glucose, those numbers are like about 7%, and now it's reported to be like about 11%. Cholesterol is pretty high up there. If you combine high cholesterol, borderline high cholesterol, high triglycerides, and HDL, and these are low HDL. So it's not genetic, that's largely genetic, but you could do something environmentally. So it amazes me because when we go to the Philippines, I do medical missions to the Philippines. I bring with me a lot of my medical students and undergrad. They're shocked because they will check the blood sugar of Filipinos, and their blood sugar is like 500 or 600, and they're running around in where we hold our medical missions. And so they always say, I think there's something wrong with our device. I said, well, check your glucose and see what it is. And so their glucose is normal, like 70 or 80, but people are running around with 400 and 500 of blood sugar. They don't have much symptoms. Here, people with that sugar are already symptomatic. But in the Philippines, for whatever reason, they're used to that high level of glucose. They don't have much symptoms. Hypertension is another condition where people are largely asymptomatic. So wala naman akong nararamdaman, bakit binibigyan mo ako ng gamot? So that's, that's a problem. And it is also a problem here because we give asymptomatic patients medications that will give them side effects, so they stop it. So compliance is not just an issue here, it's an issue in the Philippines. The difference is we have medications here, they don't have medications in the Philippines. So their resources is very limited Here we have insurance, we could buy the medications. In the Philippines, they can buy the medications. We do medical missions. It's basically a Band-Aid approach in chronic disease, because once we leave and once they finish the 2 months of medications that we give them, their condition is back to baseline. Blood pressure, 200/100, and they feel fine. Glucose, 400/500, they feel fine. So there's got to be much more than just treatment, and I believe in prevention. So I think we have to start at the very core, our children, and start there. And the children will educate the older people. Next slide, please. So I'll pass this because it was already done, the metabolic syndrome. So this is the clustering of cardiometabolic risk: obesity, hypertension, increased waist circumference, HDL, low HDL, and high LDL, smoking, physical activity. So I'm not sure if there's someone here who will talk about exercise and how exercise actually improves glucose metabolism. Next slide, please. So this is the data, and this is in 1991, and it's very fascinating how Filipinos are ranking high up there in terms of all this cardiometabolic risk, with smoking, increased cholesterol, diabetes, being overweight, and hypertension. Next slide, please. This is again comparison of all these risk factors all across the board, comparing Caucasian with African American, Asian, Hispanic, and Filipinos are again high up there. So this data is there. We know it. I'm not sure what we're doing with it. I think we're trying to do something about it, but I think we have to consolidate our resources. We have to combine research and science and combine it with cultural sensitivity and integrating attitudes of people, especially us Filipinos. I'll pass that because, again, these are all redundant slides. I apologize. Coleman Ryan is one of the cardiologists here in the Bay Area, had studied Filipinos. He's married to a Filipino, and he was fascinated by the tremendous risk that Filipinos have in terms of cardiovascular disorders. Next slide, please. So, what is it then? Do we have next slide?
There are for the different races. So
the
last one was for Asians, and the next one is for Hispanics.
Oh,
Filipinos.
So this is the so the risk factors are again hypertension and diabetes, obesity, hyperlipidemia, metabolic syndrome, aging, and genetic factors. The modifiable risk factors are the ones that are much more important because I cannot change your age, we cannot change your genetic material, but there are something that you could change, like smoking, obesity, diet and exercise program, and you could treat hypertension, you could treat diabetes, but again, I will concentrate mainly on the modifiable risk factors. Next slide, please. So all of these risk factors combine to basically damage your blood vessel, and then the damage encompasses the brain, the heart, the kidneys, and all the blood vessels, causing heart failure, heart attack, stroke, and then finally death. So on this continuum, we want to prevent this continuum to even get started. So we have to start with our children and educate, and then prevent these diseases. Next slide, please. So this is just a slide just to basically underpin the comorbidity between hypertension and diabetes. They're almost the same pathophysiology. They're common in all of us. They all lead to heart failure, stroke, dementia, and awareness and treatment and control is actually dismal. It may be improving, but it's still not up there. These are all lifestyle diseases, so we could do something about them. And there are, of course, medications available to treat them. Next slide. This was already discussed, the target damage, organ damage. Next slide, please. And the complications between the two are almost similar, except for amputation, which is not as common in hypertension, but all of the other complications of diabetes and hypertension overlap. Next. So before we end up having a stroke like this, and next slide, and we have to really control diabetes. So I see that Filipinos really love to dance. I think we could conduct dancing sessions because I think I have yet to see Filipino organizations conduct like Run for Health or Bicycle or something. It's usually dancing, and Filipinos love to sing and dance. So I think it should activities should surround that, or have some activities in the casino, because in the casino, we don't do this anymore, so they're just pressed. So I said, there's no exercise anymore of the upper limbs. So I said, what would it be? They're just pressing this. So I said, so I think we have to really devise it according to what we really enjoy to do. I know it's hard. Dr. Siko said it should be a family thing, but family thing is also destructive, because I could tell you, whenever I go to my sisters and visit them, I gain, just 2 days of staying with them, I gain 3 pounds. Why? Because it's so good to eat. It's a lot better to eat when you're in a family, because, so I said, you should not put the big bowl of rice on the middle of the plate. We should just have rice on our plate. But we have rice on our plate, but we keep going back to the big bowl, the rice bowl. So I think it will be really very crucial in terms of trying to put together a program that will actually work for all of us. Eating is such a central part of our culture, and the more we see fat floating, the better it is. When I go to parties where we have lechon, it disappears with a blink of an eye. But how could really improve the flavor of our food and cut back on fat and salt? It's really tricky. It's hard. I think food is probably the hardest thing that we could change. So, why is there an increase of blood pressure? So as we get older, everything drops except high blood pressure, except blood pressure and cholesterol. So, so we're all aging. So we need to actually. I'm coughing. And then also this supersize phenomenon, it's not going away. Fortunately, in the Philippines, there's not much supersize phenomenon because still food is expensive there. But there's an abundance of food, so that's also the difference. But in the Philippines, they just pack up with noodles and rice because they could afford that. There's not much meat and there's not much, other dishes except for rice. When we go to the neighborhoods in the Philippines, when we visit them, it's really sad because their food for 3 meals a day is boiled rice, and it just changes. At noontime they will put sugar, and at dinner time they will put a little salt, and that's their dinner, and that's their lunch. So there's no nutritional component in it, and they just get obese. So obesity is also happening in the Philippines, even in the rural area. It used to be in the urban areas, the wealthy, but now the poor are also getting obese. So we have to get, not our dog running, but we should start running and walking. Next slide. So we're all busy. What is it in the United States? Is it stress? Are we all busy? Are we driving ourselves to death? We're sitting all the time. all of our work now are computer-based. We're sitting. So I think we have to change behavior, you know. Like I started doing this. In between my patients, I go up and down the stairs. And I have this app on my phone, and I kind of like derive satisfaction in looking at my app, and I said, oh my gosh, I was not doing much, but I had 2,000 steps, you know, just walking from room to room. So if that really invigorates you and inspire you, get started with something, but get off your butt and get moving. It could be just walking around, parking a little bit away from your office, or going to doing the stairs, or have a stand-up computer and start moving around when you're doing computer work. So I think we have to do something, and we have to integrate science, research, and our culture and make something out of it. Thank you very much.
Thank you, everybody, for your attention. We were told we want to give everybody a 5-minute break because we know attention span is limited during these kinds of conferences. But during the 5-minute break, we welcome you to eat. We have some healthy food options on the table. During that time, we are also going to show a video from Kaiser that was developed by Kaiser Permanente. Dr. Ziki, you want to talk just a little bit about what it's about?
This video is called Healthy Filipino Celebration. And for all of us who is eating is a celebration all the time. There's always a reason to eat out, to celebrate. And how do you manage to continue to stay healthy? Every family event is like a buffet at home. Everywhere we go, we look for a buffet. And so this video will highlight ways how you can conquer the buffet table, whether it's at home, whether it's in a restaurant, and come out of that not blowing your sugar sky high and still feeling good about yourself. So enjoy the video.
Okay, so go ahead and eat, and we'll show the video during mealtime.
We're trying to come together and create a community-supported agriculture CSA project. If you support us, please sign our paper to let us know. Because before you even get to the hospital, you need to check what you're eating, right? Yeah.
Then I was doubting whether or not I would accept it. And then they were like, actually, someone didn't accept it, so we're going to give it to you. And I was like, okay. So look at me now, I'm the only one here left.
Let's get started.
Liza and John, we're not just left. Remember, in our training, there was
Okay, Rudy, do you want to...
Part of the program, so that if you have any specific questions about any of the topics that they were addressing, you can go ahead and email them personally and they can communicate with you. So make sure that you get a program. And also before you leave this afternoon, make sure that you get a one of these bags from Kaiser Permanente, and these are some of the things that you will enjoy having when you go shopping, because these are aimed towards health. And so please take a seat and we'll get started again. I also wanted to thank Jaime Escalon for arranging this, because without Jaime here, I think we'll be like up the creek without a paddle. Okay, Amy, our next speaker is going to be introduced by Amy Afable, please.
Okay, I hope everybody's enjoyed their quick lunch and break. Our next speaker will be Joanna Snyder. Is she here? Joanna Snyder currently works as a clinical registered dietitian at the California Department of State Hospitals. She's been there since 2013. She previously worked at Women, Infants, and Children's Supplemental Nutrition Program for about 3 years while doing some volunteer work with West Bay. Her goal is to continue to work as a nutrition educator within the Filipino community to help curb the epidemic of overweight, obesity, and their comorbidities, as well as chronic disease. She's also an avid runner and a passable cook, she claims. But she'll give us more personalized tips about how to eat more nutritious meals, as well as integrate more activity into our daily routines.
All right. Good afternoon. All right. Don't we have a great spread here? We've got some fruits and some vegetables, and the lady who was getting the food ready, she apologized for the lumpia. So is lumpia not healthy? Is that what they're trying to say? So that's what I'm hoping to clarify here, is what is a healthy meal, or what are helpful meals or food? Okay, so we get started. You got it. So what I want to cover is who needs to eat healthfully and why. And as my previous presenters, I think they've already clarified that with you. What is a helpful Filipino dish? And what can we do today to make those changes? All right, I'm going to present the next slides, and you can just answer on your own. Is this a helpful dish? Oh, no. Okay. Keep going. Next one. Yummy. All right. See, now everyone's alive when we talk about food, huh? Next one. All right. Next one. All right. Next. Okay. Yummy. All right. Next. Oh, see, this is a question I get a lot, or the answer. Oh, adobo, it's not healthy, right? Okay. Oh. Okay, keep going. All right. So I didn't do rice individually in there, but what do you think I will say next? You got it! What's next? They're all part of a helpful meal. Okay. But where are we going wrong here? So next slide, try that. So they're all helpful. But here's our solution to this. As you can see, protein, meat, which is our meat, and includes the fat in there, because won't you agree that most of the fat that we eat comes from our meat? We love pork, we love chicken skin, yes. All right. And where does rice fall in there? None. This is actually still pretty consistent with diabetic diet. I mean, you're controlling your carbs there, especially the rice. And a lot of the carbs too can come from fruits. But vegetables, when you do the carb counting in vegetables, it's actually negligible in carbs. Okay, so if you do the majority of your carbs from vegetables, unless you're doing like 5 big servings of vegetables, they won't even count. So let's keep going. So is this a car? And then it's part of a car. This is a car. It's part of a car. So I'm trying to drive this home, literally, huh? So this is a car. This is the back of the car. So next slide will be, is this a car? Yes. So that's what I'm trying to say with when I was showing, is this a helpful meal? when people say adobo, or as that lady apologized earlier, she said, "Oh, I'm sorry for the lumpia." I'm like, well, no, it's part of a healthy meal. Okay, so next slide. So in the adobo, as long as we're watching our portions, and it's not a lot. I have the next slide that will show. So here, why do we need dairy? Dairy is for calcium. For bone health, it's actually shown to control heart disease in some way, because it's involved in the heart pumping action and muscle action. Next slide. Grains. So this is where our rice fall into, you know. And if you gear towards whole grain, that will really have you feel full longer after you're eating. For bowel movement regularity, I mean, we all are at one point or another been affected by constipation. And again, for heart health, whole grains have been known to, they have soluble fiber, and insoluble fiber, which lowers blood cholesterol. It's also good for colon health. Why is fiber good for colon health, for bowel movement regularity? One of the studies have shown it's actually exercise for our gut, because when fiber expands in our gut, it expands by absorbing water, and when it expands, it will push on the walls of our intestines, and our intestines don't have a choice but to push back. So it's great exercise. And again, with any kind of exercise regimen, start slowly and drink plenty of water. The next slide, fruits. So fruits, yes, they may be a little bit high in carbs, as we're talking about. This is for diabetics, but for a healthy meal, you know, I don't think you can overdose on fruits and vegetables, really, because we really need to eat more fruits and vegetables. For dessert, see, why don't we think of fruits as part of our regular meal as a dessert? When I first came here, and I remember looking at Thanksgiving dinner, and all I saw were pies and what else do they have, you know? So where are the fruits? Why can't we just do that? Next slide. Vegetables. Do I need to say more? What are, you know, when I showed you pinakbet earlier, everybody agreed it's a healthy meal, right? It is, with all the fruits and vegetables. You got okra, you know, add more of the okra in your diet. Eggplant, what are the popular ones? Upo, and tinola, we use chayote. So, you know, adding more of that. And I know as we move on, I'll try to maybe explain a little bit more of how we can incorporate that. Next slide, please. Okay, so protein. We need protein. We need protein for muscles. We need protein for, well, in this case, the fat is already included in there. And protein, or should I say animal meat, has omega-6, which we need. Fish is omega-3, which we also need. We need to, but I think we're already doing a great job in eating our meat, correct? So, again, portion control and incorporating more of the fish, which is omega-3. And as you can see in this plate, that's a really small portion of meat. And I apologize if it's not cooked. And for safety reasons, you know, you don't want to try that. But as you can see, it's really not a lot of protein. You don't need a lot of protein. And I know we've been so conditioned, like, oh, I need more protein. You know, we are all getting enough protein in our diet. In fact, if you were a vegetarian and you just cut that portion of protein in half and make that into the grains and the vegetables, that will supply your protein in there. All right? All right, so I adopted the My Plate, and I understand that, you know, we're trying to cater this symposium to Filipino diet, but we're pretty much the same as far as what do we need to improve on? What is a healthy meal? So I like the My Plate much better than the pyramid back when it was just the pyramid doesn't tell you how much portions or how much do I need. So I use the SMART, S-M-A-R-T, criteria here. It's specific, it tells you what to eat, it's measurable, and I can give you even more details on how you actually measure that. It's achievable. You know, again, like I said, when you're starting something new in any kind of habit that we want to do, we want to start slowly, and I don't expect somebody who eats a lot of protein to suddenly like quit meat cold turkey. It's realistic. And it's also timely. And I say realistic because somebody mentioned earlier here that we're not going to change our diets overnight into the broiled chicken and some hollandaise sauce. And, you know, we're not going to change it overnight. We're going to stick. In fact, studies have shown like when cultures come here to the States, I don't have the numbers, but the last thing to change in our culture is our food. When you look at those refrigerators, they will still have kimchi. They will have, you know, their traditional meals. That's the last thing to change. Next one. So we also give out recipes here, but the only, you know, there's disadvantages and advantages to a recipe. A recipe will give you, here, go and change, follow this diet, but is it smart in a way, is it specific on like how much portions, maybe some, maybe are not, what do I eat with it, or is this recipe like all-inclusive, is it achievable, maybe, is it realistic, you're suddenly changing pork into skinless chicken breast, is that realistic? And then the Academy of Nutrition and Dietetics is saying 82% don't want to give up the foods that they like. So my point here is the My Plate will really, you don't have to give up a lot of it or any of it, but as long as it will fit in that My Plate. And I'll go into more details about like the desserts and the other Filipino stuff that we eat. So when foods are eaten in My Plate and Mine, calorie and fat amounts are already in check. So like I said, we don't need a big portion of our food to be in protein or meat. So here's these are two different plates. One is pressed again, 12-inch, and the other one's an 8-inch. So for people who are between 5'2", I know our heights are not all the same. For people who are 5'2", and what's the average height maybe here? 6 feet, let's say. That would be for the 8-inch plate, okay? So the 12-inch, unless you're 6 feet or higher, and maybe work out 4 hours a day, yes, 12-inch. But for most of us, 8-inch plate. So again, when we're eating out, the portions are really way distorted here. So when we go to In-N-Out or Jollibee, or what other, you really look at the portions and they're way much higher than what a portion would look like. Okay, so to eat or not to eat, that's the question. I know, take on that, Shakespeare. Good. So I know when we think of saturated fat, what do we think of? What kind of fat? The animal meat fat, correct? So just to enlighten you a little bit, it's not all saturated fat. It's it's actually monos and poly for the most part for chicken, which is probably the best option. For pork, it's half mono unsaturated fat and polyunsaturated fat. So it's about 40% fat, saturated fat. And then beef might be the highest one. It's about 50 to 55% saturated fat. But again, if you're it's not all saturated. First of all, it's not all saturated. And if you're watching your portions, again, it's less than 1/4 of your plate, you're okay. I know we've talked about like low fat, but fat keeps you full longer, especially if you're eating rice, which is mainly white rice. It will slow down the emptying of the carbs in your intestine. And like I said, it has omega-6. So if you can add more of fish for your animal protein versus, that would be good too. That would help a lot. So the My Plate, again, like I said, they're portions, 8-inch plate. It may not be telling you exactly what's in the content of your food, but it will, any kind of excess amount of food or no matter how healthy. So if I ate adobo and rice every day, it will turn into fat because it is part of a healthy meal, but first of all, it's in excess of what I need. And then second is there's no variety in there. There's no fruits and vegetables that will give me the vitamins and minerals that I need. So here it is. So 2 plates. Okay. Again, I think I'm just trying to drive the fruits and vegetables home here. This is where we need to add more of. The Centers for Disease Control and Prevention, 8 out of 10 with CVD, or that's cardiovascular disease, reported not eating their fruits and vegetables before they had the cardiovascular disease. We really need to eat more. And next slide. So we were talking about, like, maybe some of you are saying, I'm already eating that way. I'm already eating, the vegetables and the fruits, and I don't eat much meat. But it's what the My Plate is not talking about is the absence of all the processed foods, okay? And I know I'm guilty of it too. I go to Goldilocks, or whenever I see some Filipino pastry that I'm so happy to see, I lap it up, and I'm guilty of it too, but we just need to cut that in moderation, and which I'll go into. So the Journal of American Dietetic Association, 40% of kids' diet come from added sugars and unhealthy fats. So the introduction earlier about not passing the soda taxes, it's the proceeds for that will go into nutrition education or more education, which I think we all need. And the USDA Nutrition Evidence Library, strong evidence supports the conclusion that greater intake of sugar-sweetened beverage is associated with increased adiposity, which means fat. All right, so what can we improve here? Not yet. What can we improve here?
No veggies.
Yeah, more veggies. Yes, we're missing the dairy. I heard that. And that's a little too much protein. Like I said, granted that fish is healthy for us. It's got omega-3s. It's a little bit too much, right? What's the next one? Okay, this is our famous adobo, right? So we want to... the soy sauce. Yeah, it's not a very colorful plate. Yeah. maybe just one of those thighs, and that's probably okay amount, but we need the vegetables in your fruit. Next slide. So looks like this person is trying to get healthy. She or he is on our way, but still a little bit more carbs, more rice. So maybe cut back on the rice a little bit, all right, and add more vegetables or add a little piece of fruit in there. Yeah, too much rice. Next one.
I know what's missing
What?
in these.
What?
You're looking at the plate, but what's missing is what the trend is, and that's farm to table.
Right.
Before you even think of what's on
Right.
your table, who's your farmer producing what's on your table?
Yeah, then that's a whole different topic too, which, I can talk about that all day. But yes, I agree. Okay, next slide. So this is actually an improvement, right? A little less protein maybe. And add maybe more vegetables, huh? But it's better, yeah, you agree. Okay, next slide. Okay, see again. I know, I love this too. Tossilog. We got the rice, good portion of rice in there, but a little bit more protein. Egg is already protein, right? You got your meat. Okay, next slide. Okay. What kills me with this is that soda. The plate itself, you're already eating a lot of protein, and you got the lumpia there, which is protein. What is pancit? Yes, it's made from rice. So do you really, that's like mostly carbs right there, and a lot of protein. And then you add the soda. What? That's too much. That's too much, all right? Oh, yeah, okay. Okay, keep going. Next slide. I think I think you get the gist here now. All right, keep going. Oh, that's an improvement. Okay, who needs to eat healthfully? Everyone. We all need, not just for prevention, but also for management. Managing our diets and managing if you have diabetes, manage it. Again, appropriate portions will take care of your calories. It'll, and the portions of, make sure you get your greens in there and your vegetables. The processed foods, Goldilocks, and pastries, and sweetened beverages. That's what gets us in trouble for the most part. So when I remember the SMART criteria, specific, measurable, achievable, and realistic and timely. Very good, thank you. So start with one thing. I heard somebody mention adding more water, and I know I didn't mention water. 8 to 10 glasses for everybody up to 6 feet. 8 to 10 glasses of water. If you're more than 6 feet, add a cup or two in there. Or start with, if you love if you love maybe fruit, start with adding more of that and crowd out your plate with fruit or vegetable. Okay. Next slide. I think that's about it. I'm just going to touch on this real quick. Here is how our calorie intake have gone. 1970, we're still eating less fruit, not a lot of fruits and vegetables. We're good with the dairy, it looks like, but it's those added sugars and added fats that's getting us in trouble. I already mentioned it, but these are numbers from the USDA. And then not only are we still doing more of the same 30, 50 years later, but our calories, look at the calorie in there. 1970, we averaged at 2,000 calories. Now we average at 2,600 calories. I even mentioned earlier, 2,000 is for somebody who's 6 feet tall. And that's without exercise, okay? So here we go. Make that change. We're rooting for you. Yeah, we'll go. Yeah,
Where's the
let's go.
Filipino vegetables?
I know, we've got some, what do you call it, kamote and kahoy, and I couldn't find a photo for the, she has a vegetable right there. Okay, let's go to physical activity. All right, here we go. Somebody, physical activity, keep going. All right, what is physical activity, benefits, and what's recommended? All right, go, next slide. So this is our, we get energy from everything. This is all what I'm saying. We get energy from carbs, protein, and vegetables. So, I know people ask, oh, do I need more protein? Do I need more carbs when I work out? You get it from all of these. Keep going. So, as I mentioned earlier, if you're 5'3" male, based on ideal weight, about 1,900 calories, no workout. Next one would be 5'3" female, 1,600 calories. That's not a lot, okay? No, you're not working out. Physical activity is defined as any bodily movement that results in energy expenditure, caloric, over resting. And exercise is a type of physical activity consisting of a planned, structured, repetitive movements. And then activities of daily living. These are more suitable for seniors. They represent one's ability to perform basic daily tasks such as self-care and chores, emphasis on balance and posture control, and flexibility. It's important. So benefits of physical activity, need I say more? For somebody who already had a stroke, this will prevent from getting another stroke. They lower hypertension. If you have already hypertension, it helps you to manage hypertension. Prevents diabetes, and if you already have diabetes, it'll help you manage it. It helps build strong bones, and we can go on and on. Benefits of it. Next, so the recommendation is 150 minutes a week. So if you only do 30 minutes a day, you can do that in 5 days, correct? So preferably 3 times or more a week. No more than 2 days of no physical activity. So what is physical activity? It's strengthening cardiovascular and flexibility. I know there's too much words. Cardiovascular is when you're breathing, with your breathing. So like running, brisk walking. Those are cardiovascular. Strengthening are your weightlifting. And so physical activity. In general, I know we talked about we don't go to the gym, but we can always go outside. Maybe when you're on the phone, go outside and talk on your phone. Well, you never know, after talking, we'd be burning already 100 calories. So moderate physical activity, brisk walking at 20 miles per hour for 30 minutes, that's 300 calories right there. Vigorous, so running 20 miles per hour for 60 minutes, that's 300 calories. And then don't forget your stretching. Why, the most non-compliance we get from people who start an exercise regimen is stretching. It's important because it really allows you for a wide range of motion. So for example, you've been pumping iron. Before you know it, if you don't stretch that muscle, you'll be like this. You can't move your arms as far. But if you were stretching, you would be able to move your arms in a much broader range of motion. Yeah, keep going. All right, so we mentioned dancing. We can do that. So moderate dancing would be maybe a cha-cha. It's a little bit more slower. And maybe vigorous dancing would be swing. Swing? Yeah, salsa. Yeah. So 30 minutes, that's 300 calories right there. And don't forget your stretching. Yeah, keep going. And I'm going back to the SMART goals. Okay, if you're going to start a physical activity, exercise, be specific. And, you don't have to overwhelm yourself with so many goals. Just start with one. Like I said, start with walking. When you're on the phone with your friend who calls you every day, that's your cue. Oh, Melinda's calling me, so let me go walking while I'm talking to her on the phone. Lack of time. schedule it on your calendar. And then injured, and that's a big thing with older generation, senior citizens, and maybe doing a more low impact exercise. I know Tai Chi is a Chinese thing, but I shouldn't say Chinese. But it's something we can incorporate too. But running and walking is a universal one. I think everybody can walk, for the most part. All right, so let's get active. All right.
Okay, I just wanted to, we are actually going to stream until we've, I just want to let the panelists know we'll stream until the presentations are over. The next panelist is Melinda Bender. She's a Filipino researcher, investigator, and assistant professor at the University of California, San Francisco School of Nursing, Institute for Health and Aging. I'm not going to talk about her research, she's going to talk about it, but she will give you an opportunity to begin everything that we've discussed today. She's conducting some novel interventions in the San Francisco Bay Area, and she wants all of you to be aware of.